everyone, I'm Dr. Nicole. Welcome back to my channel. I'm so excited. Today I actually have a special guest with me. It is not only another mom, but also a friend and family member, if I'm being completely honest. And her name is Karen, and she is going to be sharing her journey towards pregnancy with all of you. And I don't want to give any spoilers, so I'll let her share that with you, but I know it's been full of tons of ups and downs and so much joy and so much sadness and heartache. And so I'm so thankful that you're here, Karen, sharing with all of us. I know there are lots of other women wanting to be moms that are going to find this just really encouraging. So thank you again. I do want to give a trigger warning here that there is going to be conversation about miscarriage in this video. And if that is something that you are just not at a place to hear right now, totally fine. Just skip by this video. I just want you to do what is right for you. So thanks again for being here, Karen. And I'm going to let you just go ahead and start with sharing kind of like where your story begins and like mostly the time frame. When did all this start? This is what, September 2021. So when did your journey begin?
Yeah, so our journey began in about the spring of 2015. My husband and I were recently married, and we had our first pregnancy test that came back positive. We were really excited. We're like, wow, this is happening. And then at our 13-week anatomy scan, we got some bad news, and it turned out the baby stopped growing around 8 weeks. So unfortunately, we had a miscarriage. And then my doctor was great. She talked us through everything and said, this is very common, not anything to be overly concerned about, but, go ahead and we can try again soon. So a few months later, another pregnancy test came back positive. We were super excited and we were like, oh my gosh, yay, this is happening. And then we had another miscarriage. So since at that time I was 35, advanced maternal age for the medical world, they decided that we should go ahead and get a workup for fertility just to make sure there was no problems because my clock was ticking. So we did that, and while we were working through the treatments and the testing center, the doctor did suggest to keep trying, and didn't mean that we were going to have recurrent miscarriages afterwards.
That is like so much heartache for sure. It's like something I know that we've talked about personally, and you at a certain point it like, okay, it's just part of your story, but I know in the moment it was probably a lot harder than what you are letting us know right now.
Oh, it was definitely a roller coaster of not fun. So you'd be really excited, but then you would be very devastated afterwards. But they kept saying that this doesn't mean, this happens so frequently, but it's okay. No one talks about it. Just kind of why I'm here today, because no one talks about it. And I want to share that it does happen and it's normal.
Yeah, I think you're right on the money there. I know from knowing you that eventually you guys did seek out some fertility treatment. So kind of walk us through like what the timeline looked like and what was all involved with that.
So while we were going through the testing, there was a lot of blood draws. There was a lot of procedures. There was lots of invasive testing that was done on me. I had my fallopian tubes, uterine lining, you name it, we probably had it looked at. My husband had blood work and semen analysis being done. I tried supplements my fertility doctor suggested. I did acupuncture. We had genetic counseling to make sure that our sperm and egg was compatible. Things you didn't even know it existed.
Yeah.
We had being done. And it turned out that it was great. We were compatible. Our sperm and eggs could grow. There was nothing wrong with either one of us. We had the dreaded diagnosis of unexplained infertility, which we were thankful we didn't have anything wrong, but also if there was something wrong, you could fix it. So we just kind of had to, move forward. While we were going through all the testing, which took quite a few months to go through, we did IUI, which is sometimes referred to as the turkey baster method. We would go in and have artificial insemination from my husband at specific times in my cycle. None of that worked. We tried to do that because it was cheaper when we were progressing with the testing. And then eventually we decided to go for the full-on in vitro fertilization.
So obviously everyone's journey is a little bit different, and there's no saying what's going to work for any one person, but what worked for you and your husband? Like, how did IVF end up turning out, and where are you now?
Well, unfortunately, after all the testing, all the injections and everything else, surgical procedures that we went through, between $20,000 and $30,000 out of pocket because fertility is not covered under insurance mostly. Um, IVF did not work for us. We ended up doing 2 rounds and it we just kind of was at a wash. So my husband and I joke we should have just taken that money and gone to Bali or gone to Hawaii and had one heck of a vacation. But that being said, we were blessed to have a spontaneous pregnancy. And so we have a almost 2-year-old at home. And if all goes as planned, we will have a newborn at this time next week. So we're very excited for that.
I love it. I talked you into doing an interview a week before you have your baby, but I know you're going to be really busy once he comes.
Exactly.
That is so amazing. And I know, like I said, I know every journey doesn't end in pregnancy. And so I don't want to like give false hope that if you just wait long enough, or, I'm sure you can attest to this. It's not like, if you just do the right thing, eventually it'll happen, because we just never know. But it is comforting, I think, and will be for others, to know that sometimes it does just happen eventually, and it just takes a really long time and we don't know why. But I think that's encouraging for some people. I think some people are going to need to hear that. So congratulations. And I'm just so excited for you guys. So we've already hit on the topic of miscarriage a little bit. And I think, in case someone isn't sure what miscarriage is, it's anytime that you lose your pregnancy or you lose your baby before 20 weeks. And I don't think people realize how common it is. It actually happens to about 1 in 4 pregnancies, which is a lot more frequently. Like, nobody told me that before I was thinking about getting pregnant. Like, there's a 25% chance this won't end up in a baby. And so what encouragement or words of advice or just things to know would you have for somebody that is starting their pregnancy journey, maybe isn't very far into it, and just what would you want them to know about miscarriage, I guess?
It does happen more frequently than people think, and nobody talks about it. So I would go to work and I would have found out that I was actively having a miscarriage by my doctor, and then I'd have to go to work and show up. I mean, I could have called in, but unfortunately for me, I had so many frequent ones that it was kind of to the point where you got used to just dealing with it, which is really terrible to say. But people don't talk about it. And then when I did mention to somebody that, oh, I just had a miscarriage last week or whatever, then you'd hear, oh my God, me too. I had one 3 years ago. And it's not just people who are my age or younger. There was people who were in their 50s were like, oh yeah, when I was going through all of, I was trying to get pregnant back in the 80s, I had to try this medication because we had, multiple miscarriages. And it's one of those taboo topics that nobody wants to talk about, which is another reason why I kind of wanted to come on here and say it's okay to talk about it. In fact, it's good to get that out so you're not just keeping it inside. The best advice that I have is be very open with your significant other. I'm very fortunate to have a wonderful husband who, when I was having a bad day, he would, ask me, do you want to talk? Do you want to cry? Do you want to yell? And so he actually took me to a rage room, which is where you just go and you just beat the crap out of a bunch of things. And it was really therapeutic and really fun. And I felt a lot better afterwards. But also know that your significant other is going through things as well. So making sure you ask them, how are you doing? Are you having a bad day? What can I do to help you? Him and I would go golfing a lot, just the two of us, just because it got us out of the house and out of thinking about, what had just happened. So just make sure you have a really good support system and talk to somebody if you need to, and talk to your doctor. If you feel like you need to go to therapy, get antidepressants, find a support group. Our fertility doctor was fantastic at letting us know all the different resources that were available to us.
That's great because, yeah, there's quite a grieving process that needs to happen there, different for everybody. But if you just hold it inside, you really can't process that. So I think you saying that nobody talks about it makes it really tricky. I guess I was really thankful. Not this, that's weird, but not thankful that you had been through it, but thankful that you were open about being through it. Because when I went through mine, it was nice to be able to reach out to someone who had been there, because a lot of family and friends want to be supportive, but unless you've been through it, I don't know. It's hard for them to relate, I guess. So.
Right. And it's hard to really have other people understand that you're mourning the loss of something that was only 8 weeks along, or only, it was just a clump of cells. I had a friend tell me that once, and it was just like, yeah, no, don't say that. It was, to me, it was more than just a clump of cells. So just, if you can find someone that you can talk to that has been through it, they'll definitely be able to be a bit more sympathetic than someone who hasn't.
What are pieces of advice that you would have for family and friends of someone that has been through a miscarriage? What are things you should say or things that you should not say? I'm sure you've heard lots of both.
Oh, yes, yes, I have. Things to say. I will start off on a positive note. Ask how they're doing, but don't ask, oh, how are you doing? And then just kind of like brush it off. If they say, I'm having a rough day, then be like, what can I do for you? Do you want to talk about it? Sometimes I didn't want to talk about it. And sometimes I just needed just to have word vomit and just talk about everything that had happened and what was going on, and have like someone just to sit and listen. I had plans to go to lunch one day with one of my friends, and I was just having a bad day. I didn't want to talk to anybody. I just wanted to stay home. So I canceled. I was like, I'm really sorry. I'm not able to go to lunch today. And she's like, well, that's annoying. I was really looking forward to seeing you. And I told her, I'm just having a bad fertility day. Like that's all I said. She rang my doorbell and left me Starbucks, an Us Weekly magazine, and a giant piece of chocolate cake. Sent me a text that says, I hope your day gets better, and left. And that to me was just like the perfect thing that I needed. Not to say that coffee and cake fix everything, but it was just nice to know that she understood, even though she hasn't been in my shoes, she knew that I just needed some time to myself. Things not to say. If you just relax, it'll happen. My sister's cousin's best friend's twin tried this supplement and it worked for her. Are you sure you're doing it right? That's a good one.
Right.
Well, you know what? If this time doesn't work for you, there's always adoption. Adoption's great, but it's also not cheap. It's also, you got to be prepared to come to that point, and maybe you're not there yet. Oh, and the other thing, if you don't want to go to a kid's birthday party, a gender reveal, a baby shower, that's okay. Don't force yourself to go to it, especially if you've recently had a loss. Family members will make you feel guilty. Oh, we missed you so much. Won't it be so great to be around everyone? No, it's a personal hell. Like you're very happy for that person. You're very excited that they can go through and do with this, but take some time for yourself. Order something off the registry and do what's best for you. If you want to go for a nice long run, fantastic. I'm not a runner. I went golfing. And so that's what I would do instead. But this is the time to think of your mental health and do what's going to be what's best for you at that time.
I know one thing that comes up a lot is like, well, you're trying too hard, or you're stressed out about it. And I think it's kind of hard not to get stressed about it. Do you have any advice or things that helped you, or what was your experience with trying not to stress out about it?
So the fertility drugs that they give you do make you kind of crazy. And you've been like, you obsess about all of the timing of everything. It's hard to plan your life when you're worried about like when your next fertility window is going to be, or when you're going to have your next treatment option. So when people would tell me to relax, or when my husband and I did try to take a little bit of a break from active treatments, it was still really hard because we'd been tracking my cycle for years. So we knew like when we were going to be fertile. We knew like when the time frame should be. So even though we weren't actively trying, it still was always like in the back of your mind that something was going on. So when people say just try to keep your mind busy, it'll happen when it happens. It's really hard to do that when your mind's playing tricks on you.
Yeah, absolutely. I totally agree. We can try not to stress, but that's sometimes impossible. So that's helpful. I just have one last question, I guess, and that's if you had one piece of advice or encouragement for those watching today, what would it be?
It may seem like everyone around you is getting pregnant when you're going through this, and it seems like it's so easy for everyone. But you really don't know what anyone else is going through and how long they may have tried or what they're going through. So just encouragement, take it day by day. Really kind of lean into your significant other or your support system. We had a very open conversation about when were we going to be done. Like we both agreed we would try IVF, and when we did the 2 rounds, and when that didn't work, we both decided, okay, we can both agree we've gave it the old try, and not now we're done. So we kind of reached that together. Um, Try not to be so hard on yourself. It's easy for me to say this now that it's been a few years since I've gone through it, but it's not your fault. You didn't eat the wrong food. You didn't stop the cars too quickly, or there's lots of different things that your mind will play tricks on you. But just kind of be open and honest with your significant other, your doctor, and lean into friends and family if that's something that's going to be helpful for you. Also, if you do decide to go the fertility route, stay off Google. Don't Google, don't. Don't try and find an article to try and fix something. If you do find something online that you are interested in trying, talk to your fertility doctor about it. They are the experts. You are paying them all this money to come to a plan tailored to you. You will drive yourself batty if you just keep Googling, well, maybe if I try this thing, or maybe if I did this or that. So just give yourself some grace.
Like that. Well, Karen, I really, really appreciate you doing this interview with me, and I know it's really hard to share, and you shared with me before we started the video that this is your first time really like sharing this publicly outside of, friends and family, and I really, really appreciate that, and thank you so much for being so brave. I know it is not easy at all to share those types of things,